Good morning. Thank you all for joining. My name is Erica. I'm the program manager with Healthy at Hopkins, and today's webinar is going to be given by someone from our My Support team. So I first just want to start off by saying that everybody is on mute just because of background noise. There is the chat feature, so definitely if you have any questions or concerns, if you have any issues viewing the screen or anything, just send your comments to the chat, and we will receive them on our end and address them. If you have questions throughout the presentation, feel free to send them there, and we will address those as well. So we have Erin Gillard with us today. She is a clinical social worker with the My Support team, and I'm going to hand it over to her. Thanks, Erin.
Thank you. Good morning, everybody. Thank you so much for joining us this morning. We're going to talk today about clinical depression, the prevention, the identification, and treatment paths. And it's such an important conversation to be talking about mental health, and because we don't talk about it nearly enough. And so I'm glad you are all joining us this morning, and I hope the information is of use to you. Again, if you have questions, please do submit them to the chat. I will try to answer questions as I go along, and definitely will answer questions by the end of the presentation. So today we will explore how to recognize the signs of clinical depression in yourself and others, and the difference between depression and the blues. Also, we'll talk about different treatments, including medications and therapy, as well as self-care strategies to help prevent depression and aid in recovery if you are in the midst of a depressive episode. What is clinical depression? It differs from low mood most of us experience from time to time. All of us experience sadness and lower moods when we're going through difficult times, difficult transitions, and it's completely normal to experience that. The major difference between just an episode of feeling down or the blues and depression is really the severity and the duration of what you're feeling. Clinical depression affects our ability to feel, think, and handle daily activities, and the symptoms are present every day for at least 2 weeks. Those symptoms always include low mood for most of the day and a loss of interest in normal activities and relationships. Additional symptoms may include fatigue or loss of energy almost every day. A lot of folks that I talk to that are experiencing depression just talk about kind of the weight of depression and how everything feels harder. So it can be harder and take more energy to do things like get up out of bed, to take a shower, just to do some of the basic hygiene functions. Everything feels a little bit more difficult. Another symptom is feelings of worthlessness or guilt. Sometimes there's an impaired concentration or indecisiveness. Oftentimes when I'm speaking with somebody who is experiencing depression, they'll talk about how their brain just doesn't feel quite like it usually does, that maybe they're not accomplishing as much at work as they usually do, or it's just harder to focus. It's harder to make small decisions, like what will I wear in the morning or what am I going to eat. There can be difficulty sleeping or a feeling of excessive sleeping, where it's just, you just want to be in bed all day and could sleep most of the day. There can be a diminished interest or pleasure in all activities nearly every day. And this is one of those symptoms that is usually noticed by other people where, oh, you don't feel like yourself, you're not enjoying these things that we usually enjoy together. But it's a marker and a hallmark of depression where the things that you enjoy just don't feel as joyful as they usually do, or you just don't have the energy for them. There can be a feeling of restlessness or agitation. Sometimes this feeling of restlessness may show up as irritability. And there can also be a feeling of feeling slowed down, like you're wearing a heavy, wet wool coat, and that it's just every movement feels harder and more difficult. With depression as well, there can be recurring thoughts of death or suicide. And these thoughts can be more passive, like, I just don't want to be here, I wish I wouldn't wake up. or more active suicidal thoughts with an actual plan for self-harm. If you're ever experiencing suicidal thoughts, they are a pretty significant symptom, and it's important to get treatment right away. If you're concerned that you are in danger of harming yourself, you want to call 911 or go to your nearest emergency room. And I'm going to show the National Suicide Prevention Hotline on the next page as well. There can also be changes in appetite. Oftentimes, folks will feel like they just can't eat at all, or maybe they find that they're comfort eating a lot. And so a change of more than 5% of body weight in a month is a hallmark and a symptom of depression. So it's important to know that you can have depression and be going through a major depressive episode and still be functioning at work, still get up and do some of the things that you ordinarily do. It doesn't mean that you're just in bed all the time. So oftentimes it's hard to know. Somebody next to you could be experiencing depression and you won't know it because they may not physically be showing it. But these are things to notice in yourself, or if you have loved ones or friends that you're concerned about, these are the symptoms. And again, here are the resources if you are experiencing suicidal thoughts or you're concerned. Again, calling 911 or proceeding to an emergency room. And the National Suicide Prevention Hotline is 1-800-273-8255. As I said at the beginning, it's important that we have these conversations because, there's always the stigma of mental health, and it's gotten a lot better. I think that we have more honest conversations about it, but there's always more work to do. Depression is not a sign of weakness. It's not a character flaw, and you can't just snap out of it. Sometimes there's this sense that people will get told like, oh, just feel better, just smile. You can just snap out of it, and you can't. It's an illness. And most people who experience depression do need some form of treatment to get better. So there are a combination of risk factors that can cause depression. There are genetic factors. People with a family history of depression may be more likely to experience depression themselves, especially if you have a first-degree relative, a parent or sibling. You are 2 to 3 times more likely to experience depression. There, of course, is risk even if you do not have a genetic history, but you are at a higher risk if you do. Illness can also be a source of depression. Any chronic illness, diabetes, cancer, heart disease, Parkinson's disease, can overlap with depression often, and depression can make these conditions worse and vice versa. There's also environmental stresses, and this is a huge one, that most people that experience an episode of depression will have some sort of stress factor that opens up the first episode. And sometimes it can be financial problems, perhaps the grief, the loss of a loved one, or the change in a significant relationship, a breakup, separation, divorce, issues at work. Maybe something happens where you're feeling socially isolated, any form of abuse, physical, sexual, emotional, any major life changes. We are constantly transitioning and constantly dealing with change. And it can be stressful, even when they're positive stresses, getting married, moving, buying a new home. They can be positive, but also very stressful. I use this model with clients a lot, Maslow's hierarchy of needs, because I think it's helpful when we're thinking about environmental stresses and the things that are stressing us, to look at how they impact us on these different levels. And so on that base level is our physiological needs: air, water, food, shelter, sleep, clothing, reproduction. And when you think about even at work, sometimes when those basic physiological needs can be hard to meet, when we have a lot on our plate, or we're working on a unit with patients and we don't have time to take breaks to have food, that things are just too hectic. So really thinking about when you're going through a stressful time, how it can sometimes impact us on that really basic level. Above that are our safety needs, our personal security, employment, our health, our property, and then love and belonging, friendship, intimacy, families, our sense of connection. Above that are our esteem needs, respect, self-esteem, recognition. And then at the top is self-actualization, and that's our best version of ourselves, where we're feeling kind of in tune with who we are and feel really in sync. And it's not that we can't get to that self-actualization stage if one of these other levels is impacted, but it just makes the journey a little bit harder. Again, I think this is a good framework when you're looking at your life and thinking about the things that are causing your stress, to realize how it impacts you on these different levels. I'm going to talk a little bit more about self-compassion a little later in the presentation, and oftentimes we are entirely too hard on ourselves. And it's important to realize that we are all human and we are all doing the best we can, and that when we are affected by stress, and it touches us on different levels, that we can be affected. And it's, again, not nothing wrong with us, not a sign of weakness if we need to reach out and ask for help. So that risk for developing clinical depression, between 20 and 25% of adults may have a depressive episode at some point during their lifetime. It also affects older adults, teens, children, but frequently goes undiagnosed and untreated in these populations. Women in clinical depression. Almost twice as many women as men experience clinical depression. And there's some research around hormonal changes during puberty, menstruation, pregnancy, miscarriage, and menopause that may increase the risk. Women are at risk for postpartum depression up to 2 years after they deliver, which is often unknown. And women who are biologically vulnerable to depression, increased stress at home or work will also increase this risk. So for men, depression is also common, but it may look different. There can be more of this restlessness, angry, and irritability than the lower mood. And so that feeling of restlessness and on edge, men can feel more tired and flat and empty and lose interest in work, family, sex, and hobbies. And men are more prone to engage in high-risk or escapist activities, maybe engaging in work all the time, maybe self-medication with alcohol or substances. Men are more likely than women to have trouble sleeping, and men are more often prone to seek treatment for those physical symptoms that are rooted in the mental health disorders. Again, depression really affects the whole system, and so there can be a real physical component to it. So there, such as headaches, chest tightness. Oftentimes people will talk about digestive issues when they're feeling depressed. And so men are more likely to seek treatment for those pieces than the actual low mood and depressive symptoms. Children with family histories of depression and those with stress, loss, anxiety, or learning problems are at a higher risk to experience depression. And you can look again for the symptoms of irritability and restlessness, perhaps sadness, crying, mood swings. You may see a real difficulty with transitions. You may notice some regression. If you had a child who is potty trained to begins to bedwet again or tries to sleep with you, some regression may indicate some mood or depressive symptoms. There could be difficulty with sleep or concentration, falling grades, problems at school, any changes in eating habits that are significant. Again, those feelings of worthlessness, withdrawal from friends of activities, loss of energy and low self-esteem, and any thoughts of death or suicide. Depression is common among older adults, but it is not inevitable or normal. Life changes and losses may cause uneasiness and stress and sadness. And again, when we think about that hierarchy of needs and some of the transitions that happen, the transition from work life to retirement, the transition of having adult children and not having the caretaking responsibilities in the same way or needing to be cared for. There are many significant transitions as we age. And sadness may not be the most obvious symptom. It may look more like fatigue, insomnia, irritability. There can be confusion or attention problems, and sometimes depression can look like Alzheimer's disease or another brain disorder. And again, some medical conditions can mirror depressive symptoms, and it's always important to be mindful of medications as well, because sometimes the side effects can contribute to depression. So how is depression diagnosed? It is diagnosed with a really good conversation. It is important to be honest with your healthcare provider about how you are feeling and any symptoms you're experiencing. If you are having any thoughts of hurting yourself, if you are struggling with basic hygiene, it's important just to be honest. And a health or mental health provider will perform a thorough evaluation. The diagnosing clinician can be your primary care doctor, a psychiatrist, a nurse practitioner, a licensed clinical social worker, or a licensed professional counselor, a licensed clinical psychologist. And oftentimes, before a diagnosis of depression is given, because of those strong physical components that can mirror illness, that seeing your primary care doctor and talking to them about what your experience is helpful to rule out any physical things that may be happening. The good news is that depression is very treatable. 80% of people with depression who receive treatment will return to normal functioning. And one of the ways that depression can be treated is medication. And medication can be prescribed by your primary care doctor, a psychiatrist, or a psychiatric nurse practitioner. It's important to know that there are many different medications that treat depression, and unfortunately, it's not one size fits all. So one of the most important things to be aware of is that it does take some patience when you're beginning medications. It can take 2 to 4 weeks to start feeling the effects of medications, and can take up to 12 weeks to feel the full effect. And so it can take a couple of different trials with medications to find what works for you. So again, that honest conversation with your provider about how you're feeling, how you're doing, having good check-ins scheduled as you're beginning medication is really important. And it's, again, important to be patient because it does take some time to begin to feel the effect. Psychotherapy is also a really important type of treatment. And in Maryland, a clinical psychologist, a licensed marriage and family therapist, a licensed clinical social worker, or a licensed certified professional counselor can provide psychotherapy. A therapist is going to partner with you to explore your emotions, thoughts, and behaviors and help you find new ways of thinking, feeling, and acting. Therapy is so much about the relationship you have with your provider. And sometimes it can take a try or two to find somebody who's a good fit for you. It's not really about, like, do I like this person, but it's about, do I have a good working relationship with this person? Can I feel like I am being honest about what I'm experiencing, what's working for me, what's not working for me? It's important to know, too, that there are many different types of therapy. There's a therapy called cognitive behavioral therapy that has a strong research base, and it's really focused on changing thinking patterns. There's a type of therapy called psychodynamic therapy, which is understanding our negative patterns of behavior and feelings rooted in the past experiences we've had and working with our therapist to resolve them. Therapy can also include education about our illness. It can include engaging in support groups so we can talk to others who are experiencing what we experience. And it can include skills like meditation and mindfulness that help us improve our symptoms. Brain stimulation therapy is used for severe depressive episodes that do not respond to antidepressants when rapid relief is needed. Brain stimulation therapy is often used when somebody has had a severe enough episode of depression that they may need to be hospitalized. So it's important to note that not everybody with depression needs hospitalization, and there are different levels of treatment with both medications and therapies. There is inpatient treatment, there is intensive outpatient treatment where maybe somebody's a little bit more severe and needs to go to therapy and groups every day to get the support that they need to feel better. And then there's outpatient therapy where you'll see a therapist perhaps about once a week as you're working through and making plans and learning the skills. It's important, I think, to mention some of the complementary treatments for depression as well. There's some interesting research coming out about our diet and our gut health and the microbiome in relationship to depression. We produce a lot of serotonin in our digestive system, and there's still a lot of research about what that means in terms of treatment, in terms of recommendations for diet, but it's definitely something to think about and to read about if you are experiencing depression. Exercise is a great way to reduce depressive symptoms as well. Research has shown that with 30 minutes of cardiovascular exercise 3 times a week, that there is a good reduction in the symptoms of depression. Mindfulness and meditation are also researched and showing a significant effect in the symptoms of depression. Jon Kabat-Zinn developed a program called Mindfulness-Based Stress Reduction. He is in the University of Massachusetts, and the program includes yoga, meditation, and mindfulness skills, and takes about 8 weeks with a retreat at the end. He began the research with individuals experiencing cardiac disease, but has expanded the research to include many different illnesses, including depression. And these skills can be really helpful in alleviating some of the symptoms. If you're interested in exploring that, I put the website on here, palouse-mindfulness.org, that has a free access to a mindfulness-based stress reduction program, the whole 8-week program. It's important to know, too, if you're at Bayview, that Dr. Nita Gold runs a program for staff very regularly. There's also a program for staff through the university system. Some strategies that help prevent depression and lessen its impact and promote healing. It's important to know the triggers and symptoms. So attending a webinar like this and getting the information is really important. And to know your risk factors, to know if you have a family history. And again, to have these conversations about it, you know, talking to those in your family about their experience or other relatives' experience of depression. To practice good self-care, and we'll talk a little bit about that, what that means. Practicing good self-care does help enhance our resilience, and we want to make it accessible and want to make it something that you don't feel like that's on your to-do list, that you're just failing at as well. So it's finding little small ways to take care of yourself regularly. Also, just not being afraid to ask for help is really important. I can't tell you how often people walk into my office saying, I thought I could handle this on my own. Just reaching out if you're going through something and talking to somebody can be so valuable. And just having the outside perspective, the outside support of somebody who doesn't need anything for you can be really a good way of preventing depression and lessening its impact. Also, if you currently have depression and you're on medication, really working with your doctor before discontinuing therapy with the medication, even if you're feeling better. Oftentimes people believe that their symptoms are better, and so they stop their medications and unfortunately end up having another episode. The medications are helping you feel better, and so you want to work really closely with your doctor before discontinuing any medications. When we talk about fostering resilience and fostering our mental health, it's important, I think, to think about the things that we can control, the things we can influence, and everything that's outside of our influence. And there's so much outside of our control and influence, how other people act or their reactions, maybe the amount of tasks that we're given at work, bills, our financial responsibilities. But what we can control and influence are our self-care and our reaction and our exercise and how we take care of ourselves. And focusing on those things can help prevent and minimize depression. So when we talk about fostering resilience, it's important to think about how you manage your physical energy. I like to think of our energy as a precious resource. And if you're going through a stressful time, it's important to manage it that way. And learning how to say no to things is a really valuable thing to learn. Christine Miserandino talks about this idea of, she calls it the spoon theory, that we all wake up with a certain number of spoons in our drawer, and that we need to spend them wisely. And so if the spoons are related to our energy, that we're spending those spoons wisely. So say you have 12 spoons and it takes 2 spoons to get out of bed, but then you only have 10 for the rest of the day. So being very wise about how you're spending those. And again, saying no. I often talk to clients about the struggle of saying no to things at work, to saying no to family members, but it's okay to set boundaries and take care of yourself. Self-care is never selfish. Also, to take care of our energy, practicing good sleep hygiene is important. Putting yourself down to bed at a reasonable hour, not looking at screens when you're in bed, trying to do some relaxing things right before you go to bed can be helpful in beginning to set a good sleep hygiene routine. It's important too with sleep hygiene to put yourself to bed at the same time every night and try to wake up at the same time every morning. Also, in managing our energy, eating healthy foods. Again, that diet, and we always feel better when we're eating in a more healthy way. Doing the best we can to establish a regular exercise routine. And I try to be mindful when we talk about exercise to, again, make it accessible. Some folks are really great about setting time for themselves to get to a gym or get to exercise classes. And for some of us, that's a little bit harder. So even taking a simple walk every day, just 10 minutes, just to get your body moving can be really, really helpful. It's important to be aware of the effects of medications, alcohol, and other drugs on your physical well-being, including the quality of your sleep. Always cautious about using alcohol as a means to relax, because although it does take the edge off at the end of an evening, it does impact our sleep and make it less quality. And we want high quality sleep when we're going through stress, because when we're not getting good sleep, it makes everything feel harder. Also, to increase our energy and managing our energy, trying to engage in things that bring us joy, engage in creativity. And these, again, can be simple. What brings you joy and what brings me joy are going to be completely different. So this isn't one size fits all. And so it's finding those small, simple things that can bring you joy and trying to make room for them. So another way to foster resilience really is to work on self-compassion. And self-compassion is different from self-esteem. Kristin Neff, I have her on here, gives a great TED Talk about this and has some really great books about this. The TED Talk is called The Space Between Self-Esteem and Self-Compassion. So self-esteem is a judgment about ourselves, and it's usually based on something outside of ourselves. And it has the potential to be harmful, both if it's high or if it's low. We're in danger of not feeling good enough or putting others down to feel better in some way. And so the idea of self-compassion is the idea that we can accept ourselves just as we are, flaws and all, without judgment. And I say that knowing how hard that is. We live in a culture where we are very, very hard on ourselves all the time, but beginning to create space for the fact that we are human, that we have flaws, and to begin to create space to not judge ourselves and to mind our self-talk is really, really healing and can be really helpful if we are going through stressful times. So to cultivate self-compassion, here are a couple different ways. One is to recall being with somebody who has shown you compassion or who loves you, and just remembering what it's like to be in their presence. So even right now, just picturing that person in your mind and just noticing how it feels in the body, noticing how it can cause you to relax a little bit. And that can be one way to help us be compassionate to ourselves, reminding ourselves how that person would speak to us. Acting compassionately towards others, showing empathy is another way to cultivate self-compassion. Soothing touch, maybe placing a hand on the heart, can help us feel better. Compassionate movement, getting up and listening to the body and moving in ways that it is asking us to move. If you are in a desk position, getting up, moving your shoulders around, just walking around the room a bit. And taking a self-compassion break. And this is a technique from Kristin Neff. And so she would say to put a hand on your heart if you're in a moment of struggle, and just saying to yourself, this is a moment of suffering. I am not alone. I will be kind to myself. Because oftentimes when we're struggling, we begin to feel a little bit isolated and separated. And so many of us are struggling and going through difficult times that's really what that I am not alone is about. So just to be, again, compassionate with ourselves, recognizing this is a hard moment. Others are experiencing hard moments too, and I'm going to be kind to myself. Another component of taking care of ourselves is acknowledging our emotions. Every feeling we have has a function, even the ones that are uncomfortable, our anger or sadness. And although it can be exhausting to let ourselves feel our feelings, it's important to allow space for them. This is not about feeling better, but just allowing ourselves to experience whatever emotion comes up without criticism or judgment or trying to hold it back. Inevitably, when people box their emotions up or try to stuff it, it's out of a fear of it will take over in some way. And we're really designed to feel everything that we feel. So to make room for those harder feelings is really important. It's not gonna, it may be exhausting in the moment, but you will recover. So noticing your feelings, acknowledging them by name, making room for them, and expanding your awareness around them is important. And finding ways to express them, whether it's conversations with your friends, your spouse or partner, maybe colleagues, whether it's journaling. And when I talk to folks about journaling, it's not about being grammatically correct and being really rigid, and it's really just writing out just anything that you're feeling in the words that you would say it if you needed to. Creativity with art, painting, drawing, maybe a physical outlet, sometimes just getting the feeling out by walking it out, or you know, if you're a runner, taking a run can be helpful. And of course, professional counseling and spiritual guidance could also be a means of self-expression. So on top of our feelings there, we all have patterns in the way that we think. And something that's important to know is that we all experience this negativity bias. And this is the phenomenon where we pay more attention to and give more weight to negative rather than positive experiences or other kinds of information. And we all do this. We were designed this way. There are times in our past where it served a function to take in negative information to keep us safe. But it's important to know that our brains have the tendency to do that so that we can work to counteract that. And again, it's normal. We all do that. You can have a kind of a neutral day and something will happen, like somebody cutting you off on the highway, and it tend to just focus on that. So beginning to create some ways to let some of that go and see the big picture can be helpful. One technique to do that is creating a gratitude practice for yourself. And gratitude practices are really tremendously powerful if you're going through something difficult. And it's as simple as having, you know, a notebook or a journal and writing down 3 things a day that you're grateful for. And keeping it really simple, you know, the morning sunshine, the smell of a flower, your cup of coffee, you know, kind of stepping back and look at these things that are positive. And when I have clients do this and they do it over the course of a month, sometimes they really begin to see their life a little bit differently. And I recently had a client who talked about her relationship with her husband and understanding that there were pieces of things that she didn't even recognize that he was doing, that she was grateful for, and how helpful it was. So again, it's small, and wouldn't take that long to do and is a really good way of helping keep perspective when things are difficult. It's important too, again, to pay attention to your social relationships, particularly if you're going through a stressful time. Identifying those people who are your supports, those people that restore you, that give you energy, and being mindful of those people that tend to take more energy than they give. We all have those folks in our lives, and we can love them. And sometimes when we're going through stress, it's important to set boundaries around those relationships so that we can do what we need to do to take care of ourselves. Again, saying no is something that we sometimes need to give ourselves permission to do. No is a full sentence. You don't owe anybody any explanations. You can just say, no, I love you and I can't do that right now. Self-care, again, is never selfish. Thinking about your resources too. My support, formerly FASAP, we were the Faculty and Staff Assistance Program. I'll talk a little bit more about our services in a bit. Can be a really great resource. We serve most of the institution but we do not serve all Children's or Howard County. But Howard County and all Children's, you do have your own employee assistance program, and you can contact HR and talk to them about your benefits to get information on how to contact them. There's also the RISE team at the hospitals here and at Howard County. And that's resilience in stressful events. And that's if something's going on stressful, maybe an event with a patient that you need support around, that peers actually come and talk to you about that. Professional organizations or mentoring programs can be helpful, mental health professionals, clergy, and the people in your life, family, friends. Knowing who your resources are and thinking about that now is important. I talk often to people who have, take a lot on their plate and really struggle with asking for help. And learning how to do that when you don't need it as much, it makes it one less thing that you have to do when you're struggling. Again, finding those small things that bring you joy and making room for them is important, and making it, simple. And it can be really small. I did a workshop around this once, and somebody talked about how vacuuming a room was very satisfying for them, seeing the lines in the carpet. Again, it can be anything that brings you joy, and it's not going to be one size fits all. And when we think about joy, also taking breaks from technology is really important. Putting our cell phone down, allowing ourselves time not to be connected. Taking breaks from social media is also really important. I do a lot of sessions around social media and how it hurts people. And it's important to remember that people are only posting the highlight reel of their lives. They're very rarely posting about what's really happening. And we can compare ourselves to the highlight reel and not feel really great. So it's important to just step away from it sometimes, turn it off, take some intentional breaks. Also, minding your consumption of media and news. The 24-hour news channels can be really overwhelming. Even if you just listen to the intonation and tone of voice, taking that in can cause us to feel more stress and alarm when we're already going through stressful things. So finding room for simple things that bring us joy and taking some breaks from these other things can be helpful. Breathing techniques and meditation, again, are a simple way of taking care of ourselves. We're going to practice a simple breath technique right now called the box breath. And if you sit up in your chair and put your feet flat on the floor, let your shoulders relax down the back. We're going to inhale for a count of 4, hold the breath for a count of 4, exhale for a count of 4, and then hold that for a count of 4. And that, again, is called the box breath. And this is really simple. You can do it any time of day. Really portable and really a wonderful technique to help activate our parasympathetic nervous system. When we're stressed and we're moving into fight or flight mode, it's important to take these intentional breaks. And the breath is a great way to activate our parasympathetic nervous system, which is our rest mode. So again, feet flat on the floor, sitting up nice and tall. And as you're ready, taking an inhale, 2, 3, 4, hold, 2, 3, 4, exhale, 2, 3, 4, and hold, 2, 3, 4. And another round, inhaling, 2, 3, 4, hold, 2, 3, 4, exhaling, 2, 3, 4, and holding, 2, 3, 4, and letting that go. And if you did try it, you may notice that you just feel a little bit more relaxed. The breath is a really powerful tool to help us feel more settled. There are a couple of mindfulness apps that, if you're interested in meditation or some breathing techniques that are really helpful. Right now, we all have access. It's called the Calm app, and we have free access to this, which is fantastic, until sometime next year, I believe August 2020. You go to www.calm.com/JHU. You're going to use your Hopkins email to create the account. Don't download the app until you go to the website first to create your account. But when you do that, you'll have free access. It's usually $69 a year. There's a great program in there for beginners called 7 Days of Calm. It's just 10 minutes a day. And there's a couple of other great tools in there for some of my clients that have trouble sleeping, that, their brains are just hard to turn off at night. They find the sleep stories that are in there very helpful, and those are just gentle stories that are just kind of background noise that give your brain something else to do as you're trying to relax. There's also some great music in there for relaxation. So it's a really wonderful tool. So I really encourage you to at least just take a look at it and explore it a little bit. Another app that is helpful with meditation is called Insight Timer. And although this app does have some paid components to it, it also has a lot on there for free. And I love about this is that you can choose the length of time that you have for some of these guided meditations. So they have meditations that are 1 to 2 minutes in length. And I just find that to be such a great resource, as we all sometimes get overwhelmed by life, and being able to take 2 minutes and have somebody guide you through breathing can be really helpful. Another app that's a really wonderful and new resource with our MySupport expansion that we have, and we're so excited about this, is the MyStrength mobile app. And you can get it at the Apple App Store or on Google Play. And depending on where you work, to get it for free, at the bottom of the screen is your access code. It's either JHU or JHHS. And this app helps you manage depression, anxiety, if you're having sleep issues. It's a research-based app that uses some of those cognitive behavioral techniques that I was talking about, that is meant to supplement and help support you with your mental health. So it's not the same as seeing a therapist, but it's certainly a really wonderful tool that will give you different activities to do every day to help you feel better. And you can track your mood, set goals, and notice changes over time. So when you do download this, you can use whatever email you'd like, and it is anonymous, so even the community aspects, nobody will be able to identify you specifically. So I want to give a little bit of information about MySupport as well. MySupport covers all entities. The on-site clinical team covers everybody except Sibley, Suburban, Howard County, and All Children's. And Sibley and Suburban have access to the rest of the MySupport pieces of our program, everything except the on-site team. And Howard County and All Children's, again, you have a different EAP, and if you're interested in getting information about that, you'd contact your human resources. So MySupport, the on-site clinical team, provides in-person, short-term counseling on the Baltimore, Washington campuses. I myself am over at Bayview. There's a lot of people in the 550 building on North Broadway. We have some clinicians on 33rd Street, the ability to see folks in Glen Burnie, and the ability to see folks in DC as well. And we do telephonic conversations as well with managers, HR, and employees. Like if you have a coworker that you're concerned about and you just want to brainstorm some ways to talk to them, please do call us. We facilitate group conversations for teams that experience a loss or a difficult event. And we do presentations on our services and emotional health and stress management and self-care. So with our expansion this year from SASAP to MySupport, we're excited to provide expanded services. So now beyond the on-site clinicians, and again, Sibley and Suburban do have access to all of these resources, there is access to licensed EAP providers nationwide for our employee, the employee's family, and household members. And that's up to 5 sessions per issue per year. And those sessions are available face-to-face, telephonically, or through televideo, which we're excited to open access. Sometimes with the schedule of working in healthcare, it can be hard to get to an appointment, so having televideo as an option is really helpful. We also, again, provide that 24 hour in-the-moment counseling. And sometimes that's all somebody will use this for. Like, I had a difficult moment with my partner, I just need to talk to somebody, and they have the phone call with us and they feel better. There's also connection to support groups. There's legal consultations, 30 minutes over the phone per issue per year, and financial issues, and identity theft resolution services. So again, that financial counseling is per issue per year. And Jessica, I see your question there. In the copy of the slides are actually going to be posted. This webinar is going to be recorded, and Eric will be able to give you more information about that at the end of our session. Again, in our expansion of services, we provide referrals. We're trying to think about how to help employees with all of the stresses that life can bring. So that would be if you are having an emergency with finances, and then just for different things that come up, childcare, elder care, estate planning, credit issues, debt issues, retirement planning. If you're experiencing any sort of major life transition or just in need of support, please do call us. We have work-life clinicians that specialize in setting you up with referrals. And know, again, that there is never too small a reason to call. You don't have to take on all the stress by yourself. And sometimes, again, it's just helpful to talk to somebody who isn't somebody that you have to worry about their opinion, that's outside of the game, that's really just a support for you. So we talk to people about all sorts of things, adapting to new environments, issues at work. I work with folks on planning weddings because that can be stressful, grief and loss. And sometimes when we see individuals, maybe there's something that might benefit from more treatment than we can provide. Maybe you're worried about your alcohol or drug use. Perhaps there is a clinical depression that's going to benefit from ongoing treatment. In those situations, we do make referrals and support you until you get there. So again, MySupport is free and we're confidential. Our records are outside of Epic. And again, just reach out if you do need support. And here's our number. It's 443-997-7000, and you choose option 3. And a MySupport clinician is available. They'll listen, provide support, and help you identify the next steps. And we're available 24 hours a day, 7 days a year. So that's all the information I have today. If there's any questions, please do write them into the chat section.
Thank you, everybody, for joining. This is Erica again with Healthy at Hopkins. You can log into the Healthy at Hopkins portal and you will find a recording of this. It will likely be posted next week sometime, but it will be there. So we typically post it after the 3rd live webinar takes place. So now that all 3 have taken place, again, we will be posting a recording of this on the Healthy at Hopkins portal in our webinar archive. Any live webinar that we give is always recorded and posted there so that you can listen to it and watch it in case you can't make it while it's going on live. Again, any other additional questions, just send them to the chat and we will answer. And besides that, we are all done for today. So thank you again for joining.